Alrighty, we're back, and I wanted to show you that this is a demo box, and that's about as far as a demonstration you're going to get tonight. I'm not going to go any further than that. But when you open the box and it comes sealed, you'll see it has a nice plastic bag, and that's because there is some fluid that we're gonna put in there. So you're going to open that box, and you're not going to take the plastic out, but you're going to have this little device which actually sits over the toilet bowl, it might sit up there, it might not. And there's a nice instruction. Now, when you do sign up for Cologuard, you will get a call from Exact Science, okay? They're going to call you, they're going to walk you through the test, they're going to go over everything. And the reason you shouldn't have had a polyp or a colon cancer diagnosis, insurance won't cover it. And this is a $500 test. This is not cheap, okay? So you want to make sure, and Cologuard people will tell you that you could be charged that much from insurance in case you decide not to tell the truth. And remember, there is a medical information bureau similar to, your FBI files and all your other stuff. So the insurance companies do know what you've had done because doctors have to code and diagnose things to get paid. So it's got a nice explanation in there, nice book. You can take the time to read it. I think it's in Spanish and in English, I believe, if I'm correct. But so it does have that in there. Then it has a thing of liquid. This is a buffer, and then you have the actual collection device. And they made it kind of big because obviously you may not hit the mark. But basically you're going to put that, in here. And that's going to go over under your toilet seat so that you can hit the mark here. And then you're basically before you pour the fluid in there, you're going to use this device to actually reach in there, and this is the only time you'll ever get any stool on anything. This is the fecal occult blood test. This is the little device that you're going to get some stool in on there, and you're going to insert it back into here, and that's what they test for blood, and then that goes down back here in that category. You can see it kind of fits in there in that corner right there. So good. All right. Then after you've done that, and you've had your stool in there, you're going to empty this out. And this is, again, a buffering solution. This is nothing more than a solution to preserve the cell structures in your stool. Remember, we're looking for a methylation, an abnormal amount of a certain compound what we see, and so this buffers it. So therein lies why this test is so accurate in that it looks for a particular tissue. But with that, it has to make it to the lab. And after you've done that, of course, it has a nice O-ring and a rubber seal on it. You squeeze it down kind of tight till it flats and it goes thing. And then you don't need to put this back in there. You don't need to do anything like that. The buffer solution you can throw the bottle away. There's no need to keep that. You have some information to fill out. You're going to seal this up, squeeze all the air out of it, and seal it back up, close it up, and it has a self-adhesive label right here so that you put that in there, you put that on there, it has a label, and that goes back to the UPS store, okay? I tell patients, I've had a couple of patients that have done these on Fridays. They have gone to the Cologuard lab, and as a result of that, they have been stale dated because it should be received there within 72 hours. So it's very important for patients when they collect their sample to make it to the UPS store or make sure the pickup is done the same day. That way we make sure, and I tell them to try and do it on a Monday, Tuesday, Wednesday at the latest, because I think it's next day air service to the lab, and then your doctor will get a report usually within a week of the particular test. So it's a very quick, accurate turnaround. you know, all you have to do is ask your doctor. He just fills out the form, sends it to Cologuard, and then 3 days, you know, you'll get your phone call. Then a couple days later, you'll get your box. If you can't do it right away, this test is good for a year with the solutions before it has to be discarded and do that away. So. Again, it's a simple test. It's I feel like those guys on YouTube that are unpacking things all the time and showing you, but this is not the latest and greatest device that they want to discuss. Anyway, there's some information. You'll fill that out, and it got. Print your name, your sample date. It goes. It's very explicit. I mean, you know, this is not a technically complicated test, but I do find it. Extremely accurate, and I would encourage people who are fearing of colonoscopy. You know, we live in Pahrump where there aren't any colonoscopies done on a regular basis here, and that puts a lot of burden, plus it's hard to drive. Nobody wants to do a prep, you know, where they have to drink 144 cc's of solution. You've got an hour-long drive. You're worried about soiling yourself on that drive. There's a lot of considerations, and they give you propofol to put you to sleep, and you know, you can't drive home. So there's a lot of barriers to living when we live in Pahrump to getting colonoscopies, and this is really the next best thing. That's in privacy in your home at the convenience of you, and very reliable. And with regards to testing, I'd like to talk a little bit about that. We like, you know, there's two terms we use in medicine for tests that we do. One is called sensitivity, and the other is called specificity. So a test that is sensitive is going to have a lot of false positives. Why? We don't want anybody to fall through the cracks that actually has the disease. We want to be very sensitive. We want to catch the false positives. And then we go to a very specific test which identifies a person that truly has the disease. So, you know, even if you have that false positive and you get a colonoscopy, okay, it hasn't done so without trying to take the path of least resistance. And that's the most important thing to remember, that within medicine, we always try to do no harm. So do no harm means that's why a doctor will do a stress test for us before he takes you to the cath lab. Very hard for him to or her to explain why you bled out on the cath lab table when maybe a stress test would have shown the same thing. So negative outcomes when you haven't gone through a logical progression will usually end you up in a court of law writing a pretty big check to someone because you didn't do it in a fashion. And this is a part of that. This is a part of doing the least invasive thing to try and get the best results for the patient. So if you happen to be one of those people that turn positive, well, guess what? You know, you're going to have to consider having that colonoscopy. But then in the back of your mind, you know you're doing it for a good reason. And it's because one of your tests has indicated that you might have a precancerous lesion, you might have a polyp or a small tumor, and that could save your life. And it would be just a shame. I mean, we could really eradicate. I mean, there are some strange cancers that come earlier in life. I understand that. There's probably no way to catch all of those. But let's suppose you did have a family history of colon cancer at an early age. That's a high genetic issue. You probably could do this test. Right now, there's a lot of genetic testing going on for cancer predispositions, you know, but a lot of it is what are you going to do with the information? But I do believe, like genes for ovarian cancer, genes for pancreatic cancer, those cancers that are silent, that only show up when their tumors are big and they've had a chance to spread, those genetic testings are very worth it because you can do some screening, more advanced screening in advance, and they're doing better with the MRIs, so you don't have to have CAT scans all the time. I dread when people have to have CAT scans because it's 400 times the radiation in most cases, so we try and avoid that. So we're going to conclude tonight, but I thank you very much for being here in attendance tonight. Thank you for allowing me to come in your home and share some medical information with you. I look forward to seeing you next week.